Good evening, everyone. Welcome all to this audit and risk meeting tonight. I'd like to especially welcome Kate. Kate is the Director of Governance. Words of wisdom, your experience will be appreciated. I've got to say, an awful lot of officers. Don't be intimidated. Don't be intimidated. Ask them questions. Whatever you need to do, ask them questions, as is everybody on the committee. Could I also just ask that welcome everybody of the officers as well, obviously. I suggest to say that there's a lot. Welcome all. And could I also remind everybody speaking to press that little red button. So quite hot in, too hot. Without further ado, first item. David, have we got any apologies?
Apologies and councillors.
Thank you. 2, the minutes. This is to confirm of the Audit and Committee meeting September. Happy to approval of the minutes. Chair. Councillor Hemsley. Favour?
Chair, thank
you. Item number 3, declarations of interest. Declarations of interest this evening. Petitions, deputations and questions.
None received.
Any questions with notice from members?
None received.
Very much. Item 6, any motions?
None received.
Thank you. And the agenda order, let's get started straight away. 7. We have changed the agenda to give us a verbal update. Children. What's yours, Kevin?
Chair, I'm going to introduce myself. I'm Kevin Quinn. I'm Director of Children and Families at Rutland. I'm just going to give you a brief regarding send payments because this was raised at school forum as a matter of concern from some in terms of delays to their payments for send. So I'm just going to do that. So, just so you know, mainstream schools are paid annual amounts for their EHC. They receive this drip feed. Schools also receive high needs for have send but don't have an EHC. They receive that through family payment. It was raised at school that there'd been some delays. Whilst there was a concern raised at school forum, we were aware of the issues where we'd had delays. Just so you know, the payment therein. One of the reasons why there was some concern was also academic. That was partly there has been delay. In terms of the contributing factors for that, we have seen as we have national and over the last also seen significant support. So that's meant processes that kept up with that has led to some discrepancies. Also during this So in terms of what we've done and what we are doing, so the management of financing for payment, we did have a role that sat within the SEND service. That post has become vacant, and we have now moved the post to the finance team. So we believe that's where it sits best. That will strengthen the. That's one of the first things we've done. Just in terms of the contributing, but then we have something called, essentially it's our recovery, our approach. Part of that is about implementing in practice, and we are working with and support, label them. We also anticipate that's about a number of changes around how we areas of work. Whilst we have had that peak in those sort of capacity, have recruited in. Hope that will help. Also implementing a new. This will allow people. That will better enable. In that we're hoping to. In terms of how schools can access funding, add a non-EHCP. That's quite. I've changed that's where are required. And essentially that's it in a nutshell. Streamline.
Members, any questions to Councillor Rayton?
I dare say you can all hear the bees buzzing in my bonnet on this. Oh, this is one of my things. I'm only going to ask a couple of questions. First thing is this interesting sentence, schools are working to reduce demand. That's very interesting because I can think of various ways that you can reduce demand. One of them would be refusing to admit the children to the school, but I doubt if that's quite what you had in mind. So what does that mean? Unpick that rather bland statement, would you?
Sure. In terms of demand, what I mean is by providing earlier, more inclusive practice to children with special educational needs, thereby preventing any escalation or unmet need and to require more intensive intervention. So we're working at the earliest opportunity, essentially, to identify children that do require some additional. The view that we can maintain their education with their peers in a mainstream environment if appropriate. That isn't always the case, and some children will specialist education schools, but it's about recognising, identifying, training, and providing the right support. That's what I meant in terms of reducing demand.
I didn't think you meant anything that we should worry about. It's traditionally been a problem that a lot of SEND children are said to be coping, very interesting word, in their primary schools, and suddenly when they appear in the secondary schools they're no longer coping. So are you telling me that we're now going to finally get into the primary schools in some numbers and more or less force some primary schools to acknowledge that they might have a problem which they might have been pretending they didn't in the past?
Well, in terms of getting into our primary schools, we do have really good engagement with us, and our primaries are very much involved in special education. They engage with us on our level. So from an engagement perspective, the schools are very good. They're very training. So I think the need to identify their needs is recognised by the school. I think the challenge is the environment changes when you go from mainstream to secondary. That can exacerbate issues for children. So it's about how we can work to prepare them for that transition, and we do work with the schools on that and engage on that. So it's more to be done. The reforms are about how we can work to create environments within mainstream that better allow them to cater to a wider audience.
Are we finding youngsters coming into the county without the relevant support, without us knowing they need? Do we have a problem that not being told by other authorities when some young people come into Rutland that they may all need support? Suddenly we're faced with find it.
I don't believe that. Children come in. Transfer. Well aware of that need of.
Chair, I have two questions. The first one, the increase in numbers, is that a reflection of some of the impact of general COVID and staying at home and all that? The education children receive was consequent?
Undoubtedly, not just children within the HCP either. They're effectively home educated or educated other than at school. So we've seen an impact in those areas as well, and it's reflected nationally. So definitely is a.
My second question is that it's great that we Logic take some of the pressure off the team. I just hope that there's going to be some caveats that go to the people putting the information in. Ethically, they believe, right, I've done it now, I should get my management.
Yeah, I think it's important to mention that EHCP should be there for children that need, and our role is to make sure that the appropriate support, the right opportunity to ensure a child's needs met. I know that's not what you meant, and the system will better allow us to ask for the right evidence for schools to be able to provide that through prompts on the and submissions wouldn't necessarily be accepted until those are the source.
Thank you. I wasn't suggesting we should be trying to reduce the numbers or not giving the support, but I do know that some people expect, dealt with it and that happened. It's true. Reality that and I do hear people frustrations with systems generally, not just councils, everywhere. Seems to be why he's going to.
Chair, made a comment that schools are requesting payment. Is that how's that controlled?
So don't request payments, they request support. So we set up a partnership which allows schools to request additional support for children at ages, but they have to provide evidence about what that need is, how they're going to use funding. with the view that this may enable a child to better settle in the school. So we do that from an early perspective, needs earlier, without having to necessarily go through a long statutory process that requires a number of assessments and partners. It's about providing quick support when a child needs it. It may not prevent an EH, might not be appropriate. The way of giving. Yeah, we are reviewing how we support schools, how that funding is accessed.
It sounded like it was something that needs the way you said it, maybe.
The idea being, we want to enable schools to get timely support, but also reflected in on numbers of both. If both go up, the early intervention aspect, we challenge on ourselves to make sure the funding we invest early outcomes that we want to later on happens.
In the external audit meant that in terms of performance on children's services, 26% of the HCP are completed 20. What you described, creation of, is that going to help that target?
We have a statutory target. We know we need to do 100% with the sheer demand in the system not enabling that, nor the size of the team. Quite frankly, the answer to that, what we are doing and the actions that are there should free up capacity to enable us to better manage the demand, should improve our performance. What I would say is what you see there is a black and white. Did we meet the timescale or not? What we're going to be doing, on average, how long it takes to achieve your EA. What we want to see is a reduction in the time frame so that we show and demonstrate the impact. You missed the 20. How much are we missing by? So we're looking to provide performance that shows the direction. Our intention very much is sure we improve. One of the things we do pride ourselves on is making sure that children and families engaged in the process, work with them in the creation of their plan. Parents say to us that that's important. It contributes to the delay, but ultimately that leads to children. So yes, we're trying to improve the issues, but also we need to make sure it works.
Councillor.
Thank you, Chair. Just coming back to something Councillor Ray Payne said. He and I met with your team last year, and we were, well, I was very satisfied that you had a process, a through-growing process from primary through to the transition, as you've explained, to secondary school. In the papers before us this evening at page 54, the external auditors have raised a suggestion about milestones. And one of the things that I'm concerned about is our ability to forecast. And the feeling I have is that we have a funnel and we don't know the size of the funnel. And what I'm trying to get to grips with is understanding, given the procedures that you patently have in place, and given what you said about people coming in from outside, increasing the numbers, why we can't predict the size funnel. Thank you.
There's a number of factors that are influencing demand. COVID was one of them. You know that. COVID was one of them. We know that. The SEND reforms and the anticipated SEND reforms have had a massive impact on demand. We are seeing parents, carers, and schools push forward for EHCPs. The view that's partly because there was a view the right to an EHCP and the legal framework for EHCPs would be removed through the school's white paper. So that's driven some of the demand in the system. So, you know, that has created spikes that perhaps we weren't ready for, or weren't prepared for because of changes, to say other local authorities. But what we do for the finances, we do project based on the direction of travel of where we think we are going to help predict the future deficit we have. We are working, has been unpredictable because of factors like the school's white paper.
Thank you.
Any other questions, members? Kevin, thank you. I mean, the briefing you did the other night as well helped with me understand. Just one question for myself. Just in terms of the process, the reason I wanted you to tonight, really, in terms of moving the process in terms of send payments through to finance team, that is going to take the easy. You're happy with the process, given the complexity of how you have to deal with these education care plans? Happy that that transfer, if you like, invoicing so they get paid properly and timely, the schools get paid timely. Happy with that process, because it seems to me, just reading between the lines, your job is extremely complex. Sorting out these care plans is it just a case of then putting through to finance, right, this is what we're going to be charging schools? How does that work between you? How does that work between you?
I'm going to also look at Andrew on this one as well. It is complex. We know there's still work to do. So a simple having an officer within the finance team won't necessarily solve all the issues, because the sheer demands, some of our manual processes that we have, how our systems work, how our payment processes work, ideas of process change over time. What I would say is that we are aware of it, and we have worked with the schools where there's been payments that we've owed, but also we're scrutinising every payment, not just for mainstream schools but for other schools, and making sure that those schools charges the right amounts and don't invoice for children that aren't there. So there's lots of ongoing work that happens. It's worth bearing in mind that once a child has an EHCP, they can have their EHCP until 5. So once they've applied and they've got their EHCP, the numbers keep going up. We have to keep an annual review for every child within EHCP whilst managing the growing demand. So unless lots of closures of EHCPs, that pool, that cohort of work continues to increase. So it will be complex, continue to be complex, but we understand some of the reasons. Working very closely with the finance team to make sure we get it right. That is about sharing information on decisions at panel, which we've allocated to a child's smart management system up, ensure that we've got really good oversight of payments. We should see some of the direction of travel for demand for EHCPs, hand on heart, I can't say what that will be. We need to understand what the white paper. What I would say is we are working closely with our schools. We had a meeting weeks ago where we talked about the pressures in the system. I have some meetings in March with primary and secondary schools to talk about how we can utilize capital funds to try and provide environments which children in May. So working hard. We're part of the change programme, the SEND team, so we're still looking at initiatives in our schools, working hard to not only manage demand, meet also our creation of payment. I don't know if you want to come in on your own.
So we've had a new member of staff start on Monday that is going to enable this payments to schools from pretty much today, working with the process. So already process mapped existing out, so we opportunity to start, got the resource hand, so we can, and it creates a segregation of duty. A lot of the time the same person is entering the information, and then these that control is going to person in the team, so the SEND team will check and then process, so it should remove It also removes the issue we have of single failure in the finance officer. What it bringing the result adult social care as well. Risk of single staff updates happen. That will be if somebody leaves, if there's a similar people that that's the benefit of bringing.
Thanks, Andrea. Thank you very much, Kevin. It's been an interesting thing. You know, I think we sit here as an audit and risk, we understand the processes. We also understand that scrutinised to the nth degree, which it has to be, extremely difficult. So thank you very much for coming in. Certainly feel a lot more assured a few weeks ago. So appreciate your time. Okay, so we'll go on to the next item of the agenda, which is note to self, keep your place. We're with Kim now on item 8, safeguarding audit. Kim kindly came in earlier and you was promised to come in for this meeting, and here you are. So the floor's yours, Kim. Thank you.
Thank you, Councillor Corbyn. Excuse me if I start coughing. I think we've all got a bit of a cough today, haven't we, around the room. So this is a verbal update. We did ask you if we did talk about having another audit through Welland, but actually decided that you just wanted a verbal update on this. However, what I have done in the meantime is ask Kelly to complete our own internal audit as well, which has just been finished around, and it's a 58-page audit that has looked at workflow, looked at the team, so gone into a deeper dive. So even though I know you didn't want it, I wanted further assurance, because it is such, state the obvious, it's such a high risk area, and it is increasing in demand, ever changing and ever more complicated, which I've asked Kelly to pick up. So we've been doing that in the last 6 months. Alongside that, what I've also had is Kelly and Catherine Willison, Head of Service for Safeguarding, meeting with the team every 2 weeks. And they work with the team on risk and pressure that's happening in the team, on compliance, on procedures, just to make sure that we're constantly giving that team support and oversight and guidance and to get where we need to be. We've already put the resource into there. What we've also done is put resource since that time into our compliance team that works very closely with safeguarding. Compliance sits very much around care homes and dom care providers, where a lot of our safeguarding's coming from. So that also supports that service. I would say to you that there will be some high-level areas that Kelly's going to talk to you about the further work. So what we're going to do now is look at the further work this audit has come through over the next 6 months, but also when I meet with Rachel in January to look at next year's audit, I will be putting safeguarding again, that priority area. So it won't be that it misses the year here, it will come back to you. But that doesn't mean that we're not working all the time on that safeguarding team, on the areas of procedure, on risk, training and support. So I just thought it'd be useful if Kelly just gave you some high-level areas which have come from that review to give you just an understanding on what we're finding it's looking like in the safeguarding area.
Good evening, everyone. My name's Kelly. I'm principal social worker and lead for quality. Kim said we've been undertaking comprehensive audit about the team. So just some of the key areas that I wanted to highlight. A particular piece of work was particularly in relation to one of the actions, feedback. So we have a requirement to provide feedback to referrers to provide them with clarity on our actions will be, whether we're going safeguarding or not. Our audit and qualitative review certainly shows that there are improvements in that area of practice. Still some slight areas that we need to strengthen, but done alongside it is just have a look at some of the processes that support clarity around providing feedback. So joint safeguarding operation team are responsible for safeguarding tasks. So we have looked at strengthening. But it is something that we acknowledge, particularly because safeguarding is such a high risk area, that we ensure that we do have that, continue to have that consistent oversight around statutory functions, which, as Kim said, fall within things like safeguarding things, have regular contact with the safeguarding teacher, clinical supervision, safeguarding teacher, and her regular. We have a lot of mechanisms in place that. What I did want to highlight as well is that the audit has certainly evidence that we're seeing an increase in safeguarding. Yeah, we have seen an increase in concerns and also an increase in Section 42 inquiries, which are safeguarding inquiries. And within that, what we've looked at is whether there are any themes areas. And as I said, concerns connected to the provider sector certainly are a theme. We've always had a good relationship with providers. We always concerns or notifiable incidents. What we have, in my view, seen is changes in our provider market. One of the other areas that I think it's important to note as well is that we are seeing an increase in complexity as well. So certainly an increase in abuse and financial abuse that also constitutes a crime. So we are seeing areas around fraud, misappropriation of funds, all of those more complex inquiries that involve holistic multi-agency approaches. So by nature of that, what we're also seeing is that our timescales are being impacted. So our aim is generally to look at inquiries closing within a 6-week period. Seeing is that the nature of complexity, often involving risk, adults who may not be able to make decisions for themselves. Capacity Act, look for advocacy within that process. We work with families, also because of that component around potential criminality, that can prolong the process. So I think there's certainly work around acknowledging whether those timescales are realistic safeguarding, and that's because of the fact that we offer statutory duties in that working, but just seeing that impact. As Kim said, compliance has been a service that's been very affected. So we really want to ensure that we've got that proactive preventative support in our care providers. We provide monthly updates and meetings with clients for our homes and domiciliary care agencies that have had any notifications, but very closely with CQC. Currently are looking at recruiting another resource into compliance just to bolster that service. At present, it is a high level of demand, and also similarly, Kevin highlighted failure. So we want to mitigate that. And then just to pull out some of the learning and areas that we'll focus on is we have seen some fluctuations in retention recruitment in the safeguarding team. Again, very small team managing high amount of complex demand. So we have got posts we need to stabilise. That's going up for interview shortly. We've got a lot of work we want to do around efficiencies within the team in the sense of dashboards, oversight, tools that allow the team to have that live access to information and concern. So we do have a scorecard present, but we're looking at Power BI, a bit more efficient manager and the team. And then there's a lot of work that we're doing around prevention, so particularly some of that proactive work that we want to continue doing with providers, because they are quite a high proportion of our overall inquiries. So it's an area that naturally we want to look at. Are there any to do in a multi-agency way to try and manage some of that demand particularly? And also those ongoing conversations were opportunities to connect with our partner agencies. Particularly, as I've said, we're seeing a lot more involvement with police. We have contacts with health colleagues. We want to ensure that we're continuing to strengthen the relationship. So that's some of the primary.
Members, so Councillor Rapine.
Two questions. I'm assuming, sadly, when you mention misappropriation of funds, this is actually often family members exploiting their elderly relatives. Would that be right?
You are correct. Yes, it will often involve particularly family or friends that are in positions of responsibility that have power of attorney roles, which means that we trigger involvement from the Office of the Public Guardian, who oversee the regulation of those roles, and unfortunately they're experiencing delays. Well, so it increases complexity, and sadly we are seeing an increase.
So it's another case of demand exceeding supply. Okay. Second point, I'm just making an obvious point really, but there's nothing beats contact. People with the right nose, I'll put it that way, going in and looking and seeing. AI can't do that. So I'm sorry to hear about the vacant posts, and I hope they'll be filled as quickly as possible, because that, I think, is the best part of safeguarding. Somebody going in and smelling the atmosphere and saying, this is not right.
Thank you. Just to come in, absolutely, we do have a vacancy at the moment. Last time I came here, we spoke about getting that rooted team in place. What we've done, we've additional over a period of time, so that we do have responsive service, absolutely, like that contact with people. So we have actually, despite their post, very good quality. So just to give that reassurance, we've still been able eyes on situation.
Catherine. Kate, our independent member. Kate, the floor is yours.
Thank you. You girl question. You mentioned counter fraud. I just wonder whether you had a local counter fraud service here that did kind of a proactive programme of work and training with teams like that.
I would need to have a look into that. As far as I'm aware, with any of those inquiries, we work quite closely with the safeguarding hub within the police, and they will connect us into relevant agencies and safeguarding inquiry. So I know that when we have had circumstances of fraud, and we're seeing particularly also online fraud occurring, they have connected with a specific department.
Council.
Thank you, Chair. Just to come back to the comments made on staffing, I think at scrutiny we expressed a concern about the pressures in the finance team arising from local government reorganisation, and those same principles I think apply. That agency staff do actually fill a gap, but I think it's important that there's a stable workforce. It's fairly fundamental. I'm interested to understand a little bit more about the police contacts. I was due to have a meeting with the Police and Crime Commissioner on Friday, but unfortunately for personal reasons I had to cancel that. But I am going to see him again. I'm just keen to understand how much support we actually get from our police force in the work that you do. So perhaps if you just expand a little bit on what you said.
Shall I come in? Yeah, thank you. It's a really, really good point. Of course, much of our safeguarding work is multidisciplinary. So we do need to work really closely with other agencies, including police. We get really, really good support and direction from the police. I have to be honest and say they are under a tremendous amount of pressure. I cannot not say that for any agency. So I'm going to talk practically about things like meetings, so strategy meetings, case conferences, where we need the police to be there, and sometimes it takes a while to organise those meetings and move on through this investigations because of getting police and other agencies to be available. It's not for lack of support and intention, but just it's just capacity sometimes. It doesn't increase the risk or harm or anything like that. They'll respond to us really quickly in situations, but when we're looking at progressing through inquiries, sometimes that does cause a delay because of their availability. So
yeah, absolutely. And just to add to that, our local police forces are really responsive and we have very good relationships with them. And we have a joint action group which they're fully part of as well, which sits along the safeguarding but also manages very complex cases. And also if we have any issues, you know, we have a sergeant that we know directly who to contact, and so that helps. The aspect of around that MDT meeting is just getting, it's a pressure for all partners, trying to find a time that suits everybody, and Teams helps with those strategy meetings. That's the hardest part, and that's what impacts on the timeliness that we've talked about before, holding cases open for longer. But the upside of that, it's a thorough piece of work and it's concluded properly rather than working to a time scale and not having that full MDT meeting. So you have to balance one to another in that actually it's better to have a qualitative, good conversation on risk and shared responsibility, and sometimes you're going to be out of those times. So I would say from a Rutland perspective, we have a very supportive police workforce, but as all partners, as we do, there are those demands on time and availability.
MDT for the uninitiated?
Oh yes, multidisciplinary team meeting, sorry, Councillor Ross. And just from the agency, yes, absolutely, sorry, acronym. And just from an agency point of perspective, the agency, agency worker we've had in safeguarding team has been with us for over a year. So actually, there is that consistency, but she's excellent and she's got really good practice. So yes, there's downsides to having agency workers, but actually with someone that's so good and can offer that stability to the rest of the team, it keeps it on balance of capacity, whereas that tips very easily with the safeguarding team. We can have massive peaks that really impacts on efficiency to get all the work done. So keeping that stability of a workforce is really crucial to managing those high peaks throughout. Interesting, isn't it? It's not just this gradual upward trajectory. It's these high peaks that happen every so few months that then impact on a huge demand. And Kelly talked about that complexity really changes how quickly and how much work we have to do with partners to be able to get a good sense of what that looks like. And again, around eyes on, absolutely, it's the best way of managing. Get eyes on, get out there. We've also got an awareness campaign, see something, say something, that we need to be able to cascade out to everybody, to the public, to also alert and not feel afraid to. And we talked about that at a members brief
questions, members? Okay. Kim, Kelly, Catherine, thank you again. I mean, we raised this and so much. I was just looking back at the other things. A couple of things really for me was there was concerns about whole council being made aware or e-learning things within the town council, whether that's been improved upon. One thing that comes across very loudly with our processes is here, it's all well and good having processes, but as you say, it's all the buses either arrive at once or then you don't get a bus for 3 weeks, you know, and when they all arrive at once, you've got that pressure. I would say that in those instances, you know, time instances, it's important to get it right, isn't it, rather than, you know, if you're a couple of days late with the form, maybe so be it. It's best to get it right. So that demand, I don't know, you've always got to deal with
we
that.
ideally want to do both, but at the moment you have to make sure that the safety of the person is at the centre of that.
Thank you very much. With that, we'll move on to item 9, which is to receive report number 120 from the Chief Internal Auditor, Rachel. Rachel, the floor is yours.
Thank you, Chair. So this is the latest update on the delivery of this year's internal plan. So the update is provided for you in the usual format that members of the committee with, but I'll talk you through sections. So the Appendix A starts on page 15 of your pack. So on page 17 of your pack, page 3 of the appendix is a copy of this year's internal audit plan with the status of each of those assignments and the outcome. Also within the report is an update on the implementation of actions arising from our audit review. So in Appendix B on page 22 of the papers today is an update on those. So since the last committee meeting we have had 8 actions which officers have completed. And we currently have 20 which are overdue. That is the same number that we had overdue at the last meeting in September, but the number has changed slightly in that the number that are over 3 months overdue has reduced. We have a little bit more that are less than 3 months. So that has reduced from 14 to 11 over 3 months. Also, there is an update on our customer surveys on page 23 of the pack. With the outcome of 1 for your info. So since the last committee meeting we had finalised 1 audit report which is included for you within the audit plan table, page 17 of the pack, which related to the readiness for the new waste reform requirements. And as you will see on page 19 of the pack, that received a substantial assurance opinion. Both the control environment and the compliance element with a low organisational impact overall. So that is our highest assurance rating, and I have nothing to draw to the committee's attention of any areas of weakness arising from that. So I'm happy to take any questions, Chair. Thank you.
Kate.
Thank you, Rachel. Really helpful report. Really interesting to have a look through. I've got a couple of questions for you, if that's okay. Again, they might be a bit new girls, so do excuse me. I note from the report that delivery remains on schedule, but I just wondered, out of the budgeted 360 days, we've got 207 left to deliver in Q4, which I don't know about the council, but it's always quite a busy time for staff, and I'm just coming from the NHS. But I just wondered if you were concerned about delivering over half of the plan during that period of time, and whether you felt that you would be able to achieve the 90% that you aim.
Through you, Chair. Yes, I'm happy to comment on that. And clearly, you are part of a shared service for your internal review. So Rutland delegates it to North Northamptonshire Council. So we work with a number of different local authorities to have a shared service. So that does give us the flexibility to move our resources around. So some may be more skewed towards the end of the year. Some plans may be delivered more the first half of the year. We do tend to have it more skewed towards the end of the year because of a lot of the financial audits that have to be done in Q4 and the procurement compliance and things like that that we like to cover the full year. So it does tend to be more to the end of the year for those. We have had some delays on some of the audits, and I did mention that in the body of the report as well. We've had a few that have been delayed due to evidence not coming through in a manner. So that has been escalated, and we are hopefully going to see some progress. But overall, to answer your question, I am satisfied that we can deliver.
Thank you so much. That's really helpful. And I just wanted to pick up on the actions that are overdue that you mentioned. And it looked to me in Appendix B on page 22 as if there were 2 high priority actions that were due in the last 3 months that hadn't been implemented. And when I had a look at 20 actions being overdue generally, it seemed that there was quite a high lack of follow-up in terms of its follow-up rate compared with what I might expect to see. And I just wondered if you had a view on the reason for that, and whether that was maybe staff capacity, or whether the actions were right, or whether staff had buy-in of those, and whether you had any concerns, really. Thank you.
Thank you. Yes, another good question, and something that the committee has raised at previous meetings, as members will be aware, and something that has been flagged higher as well, in terms of when they do creep up. So it's positive that we don't have any that fall into the category of high priority over 3 months overdue at the moment. So the 2 that were high priority less than 3 months were both due at the end of September. At the moment, they're not hugely overdue, but we don't want to see them creeping into the over 3 months overdue category. We have received updates on both of those, so we're satisfied that progress is being made. So it's not that the action has become redundant or anything that's not been progressing as it should. And we will continue to monitor that, and hopefully we'll see those do conclude soon. In terms of the 20 that are of the medium priority, again, as I said, the number that are over 3 months has come down. So some of those older actions have been closed, but we're now seeing an increase in those that are less than 3 months. So we will continue our focus in this area. We do report it regularly to the management team as well, and I know it's something that's as well. We do receive regular updates, so we do actually follow these up on a monthly basis. So whilst they only come to the committee on a monthly basis, we are continuing to monitor that in the meantime and chase up for progress. So I have been reassured that at least 1 or 2 of them are due to be completed in the next week. So hopefully some of those will be coming down. So I'm not in the position where I think any of them are redundant or not being progressed in any. So I'm overall satisfied that we are getting some traction with those.
Okay, any questions, members?
You mentioned North Northamptonshire, and that we've got to have one eye on LGR, I think, from now on. So that arrangement that we have presumably won't survive LGR. So who's going to keep an eye so that when we break that relationship, which I assume we will have to do, there isn't a hiatus, that is a smooth transition?
Are you able to answer that question, Rachel?
I think it's
we're
probably...
all conscious of LTR, but I'm also very conscious of what questions or what ability you may have to. I noticed Angela, would you like to come in there?
Absolutely right. And again, it's a very good question, and it's one of universal application in a sense, in the sense that it will pertain to many of our contractual arrangements, and it's one of the key things that we will be keeping a grip on as we go through the local government organisation process. And this time next year, it's undoubtedly going to be the case that we will have much clearer knowledge of the sort of unitary authority landscape that will be in place across LLR, and we will be working towards that. So across a range of our contractual arrangements, we will be able to start doing that preparatory work in order to ensure the sort of smooth transition that you've got in mind. And again, that is absolutely of universal application. So whether that's contractual arrangements, whether it's delivery of services in a different way, whether it's our assets, it's absolutely one of the fundamental pieces of work that we will have to involve ourselves with, as I say, at the same time as being obliged to do everything that we're doing at the moment.
Yeah, go ahead.
I'm very pleased to hear that. Thank you, Angela. I mean, we all know that it could be potentially a slippery slope, and if we're not absolutely on it from day one, or even before that, we could find ourselves running to catch up, and it won't be a very comfortable position for this council, I don't think.
No, I think with the work plan, I think with officers, we're all extremely aware, and it's a difficult time. We're asking the questions at what stage, at some point, you know, where we will have a role, I know, as audit and risk in the process going forward. Again, mate, Angela, would you like to?
Thank you, Chair. And what I would also say is that absolutely we would be foolish to underestimate the demands on us and the huge volume and complexity of work that we will to be engaged in across the whole organisation. However, I would also say that we are not the first to do this, and we have extremely good and useful links with colleagues in other organisations who are very, very generous with their insight, generous with their time, very keen to let others know what worked for them, what didn't, what they wish they'd done in a different way. So I think it's important to maintain that dialogue and to utilise all of our networks to the best of our ability in order to deliver what Rutland needs, and to ensure that, you know, Rutland is in the best possible shape going into whatever new unitary authority we're moving towards.
I think from our perspective, and it's just linked to Rachel's question from Kate there, you know, in terms of things not being kept up with the actions afterwards, it's going to be in the back of our mind. You know, we understand that, you know, officers, you're being pulled in all directions, and so it's going to be in our mind if we're slipping behind. Is it LGR? Is we having to pull resources elsewhere in order to do this? So this is from a you know, I think perhaps we as a committee, we've got to really focus as well, not just on LGR, but actually making sure the council runs as it should do up until that point. So it's business as usual perspective. Any other questions, members? Councillor Ross.
Just an observation. I think it's important to recognise that we have actually managed this process so far effectively internally within the respective authorities, within the grouping of three, if you like, rather than resorting to external resources. And that is a positive thing. That's saving money for residents. It brings a depth of understanding to the process. So that's an important approach that we've actually taken, and that does mean that certain things may slip. And I say this as a former FD. I'm quite relaxed about what I see. Thank you.
Thank you, Councillor Ross. Okay, nothing further. Then the recommendation for the committee is that we consider and note the audit progress report at Appendix A. So we don't have to vote. So we will move on to item 10, the internal audit plan development, to receive report number 123. Chief Internal Auditor Rachel, if you would like to, the floor is yours again. Thank you.
Thank you, Chair. So this is just a brief paper for the committee today to kick off the development of this year of the internal audit plan for 26-27. So this year's internal audit planning process. So I just wanted to bring this paper really to inform the committee of how I will be informing the internal audit plan, which essentially sets out our schedule of work for the 12 months ahead, and to give you the reassurance that it will be in line with the global internal audit standards and how it's aligning with that, but also just to give you some insight into the things that will impact on the plan coverage as well. So we are looking to develop a risk-based internal audit plan, so we will be obviously referring to risk registers and risk entries. We'll be looking at the council's corporate plan to understand what the council is trying to achieve and the objectives that we could have risks impacting upon. I'll also be consulting with all of the council's directors as well to understand their priorities and risks for the year ahead. And we will be considering our existing assurances as well in terms of other internal audit coverage over the last few years that may revisiting, or areas that we've not covered in the last few years, and any other sources of assurance that may reduce the value of any internal audit work as well. So if we have other sources of assurance, we don't want to duplicate with those. The other thing that we do like to do as part of this process is to consult with the Audit and Risk Committee yourselves. So again, that also starts that process off. So I'm more than happy to receive any suggestions from the Audit and Risk Committee of areas of risk where you require assurances in that financial year. That will feed into that process, so it will not necessarily go straight onto the plan, but it will be risk assessed along with everything else that comes out of that planning process. and that will all then result in a risk-based internal audit plan that I can bring back to this committee in March for us to commence work from the 1st of April. So I'm happy to take any questions, Chair. I would also welcome any suggestions, but I don't expect all of them to be reeled off today by the committee, and I'm more than happy to receive those after the meeting if members are happy to contact me. I have suggested in the report by the end of January.
Thanks, Rachel. Committee members, if I may, through the chair, any things that you want to put on, I think it'll be the 31st of January, I think. Could you come through myself and Karen, please, so that we've got there, but I think that I'm sure they'll be coming through, Rachel. Kate, you had a question.
Me again, Rachel. Again, might be my NHS background, but 360 days seems like a pretty big plan. And I didn't know, A, how that might compare to other councils, B, whether we were looking at any cost reduction for 26-27, and actually whether the size of the plan is having a potentially detrimental impact on the council staff's ability to implement the follow-up recommendations, because it seems pretty big from an NHS perspective. It seems pretty big. Thanks.
You, Chair. It's something that we do revisit regularly to make sure we've got the balance right in terms of audit plan day coverage, and some members of the committee might recall that we did reduce the number of days in the audit plan, I think a time ago now, about 5 years ago potentially, by a small amount, just to bring it down to 360. I think it may have been 390 previously, and it came down. But when we do compare it with other organisations, it's not actually that big an audit plan. So as another unitary, clearly on a larger scale, but at Northamptonshire we have over 2,000 days in our internal audit plan. Other smaller local authorities that are not unitary, so just district and boroughs that don't have all of the county council functions, tend to be between 235 and 265. So that recognises obviously the additional functions that you have around children's, adult services, waste collection, highways, and some of those high risk areas that we. Having reviewed that against and benchmarked it against, I don't feel that we could reduce it very much from 360 to enable me to still give my internal audit opinion at the end of the year to make sure that I've got the right breadth of coverage. So I do feel it's about right, and it's something that I would need to consider in terms of the standards if we.
Any other questions, members? One for me, perhaps for Councillor Johnson. There's a corporate plan review for next year. We need to put questions in. Tell me off, but I've not noticed it on the forward plan. What committee know about the corporate review for next?
Thank you. Are you referring to the corporate strategy refresh, Chair? Yes, it is on the forward plan, and it's going to Cabinet in January. It's travelling with the budget papers, so it's coming to Cabinet in January and to Council 26th, 27th of. It's coming to Budget Council.
That's fine. So we've basically got a month. That's what I'm thinking between them. Hold on. Yeah, hold on. Let's hold on. Dates. When do you need our dates information in for next year's plan? Talking about 31st of January, were you not?
Ideally by the 31st January, yes, because we do need to bring the draft plan to you in March, which means I need to develop that by mid-February to get that in line with the paper.
Okay, so. I'm just thinking if the corporate strategy refresh is seriously different, well, that are you going this year?
You'll have early sight of it at the very beginning of January. It will be published in Cabinet, so that might be the date to look out for. Get the usual reminder through Modern Gov. And,
yeah, but the 5th of January will be the.
Thank you. A bit slow on the uptake sometimes, but yeah, I think that's important. Thank you very much. Any further questions for Rachel? Okay. So the recommendation is that the committee notes and endorses the proposed approach to developing the internal audit plan for 26-27, and that the committee highlights any risk areas where assurance would be of value in 2026-27 to the Chief Auditor by 31st of January 2026. Please could I have a proposer and a seconder to approve? Three pains. 2 pains. All those in favour?
Unanimous, Chair.
Thank you. So, on to item 11, the Auditor's Annual Report 2024. To receive the report 119/2025 from the Strategic Director for Resources. But I think, Helen, you're presenting it for us, I believe. So, the floor's yours. Oh, I thought Helen was presenting this one. She'll help. I am happy with any way. Apologies, Kirsty. Then the floor is yours. Or Andrew. So Andrew.
We really get a chance to say something really nice.
Whoever wishes to take the floor, please take the floor.
Right. I can't take the floor. It's too heavy, but I would try. I wanted to get in first because I wanted to say rarely have I seen such a positive audit report from an external auditor. I've got experience at Grant Thornton, ironically in the NHS, and they're not necessarily known for their complementary behaviour, let's say. And seriously, if you look at the greens on the value for money report, you know, we've got 2 greens. It's incredible. I think this is a really good reflection of what we're doing in finance, and I think it's we should really appreciate the job that the officers and the director are actually doing in the finance area, because this is quite a special report. Thank you.
Kirsty, would you like to speak?
Absolutely, thank you. So I was going to do a tag team with Helen, indeed. So if this report feels and looks familiar, it will be. It was alluded to and discussed verbally by Helen at September's meeting, and then we did indeed circulate it virtually. So this is it coming into the public arena, although it has been published on the website before, but for enable you to scrutinise accordingly and to ask questions. It definitely includes the value for money element, which is the bit that Helen verbally updated you on in that September meeting, as part of our statement of accounts procedures. So we had the external audit on the accounts, and then we had the value for money opinion as well. You'll see that within the report there are 2 improvement points raised. You won't be surprised that send is one of them. Thank you. Absolutely, because financially it is our biggest risk facing the council, with significant implications, and we also know that there are due to be further announcements as part of the settlement, either due just before Christmas, but most likely afterwards, I imagine, subject to further ministerial discussions that they're having. So definitely one to watch. Linked with Andrew, but just to note, this is an impressive report and one of the best that I've seen in my career. So all credit to the finance team that lead very much on the external audit, but it's a whole across the whole organisation as well. So credit to all officers and members indeed for this achievement. Hopefully Helen, I normally tag it here, Helen won't undermine that, but I don't think she will. So it reflects positively on the financial management and governance arrangements we have in place, but also I think it's noteworthy that GT have commended our approach on financial planning and how the budgets are set as well, with that corporate strategy, making sure everything's affordable, and that links back to councillors' commitment about financial sustainability being your #1 priority. So you can see it all flowing through from your council meetings through the budget and the way we plan as well. So I'll pause at that point and hand over to Helen.
Thanks, Chair. Thanks, everybody. Yes, so as has been trailed already, you will remember I sat at this committee previously and we went through the audit findings report, which is primarily around the financial statements. At that point, I think we were pretty much there in terms of the work on the financial statements, but we were slightly behind in terms of the value for money work. So we agreed through this committee that once that was finalised, you would all see sight of it, but absolutely recognising this is an important public report, so it's right that we have that discussion now. It's really pleasing that we managed to sign the opinion on the 31st of October, which I know Kirsty has alluded to in the covering report, but it is one of a handful that got signed on that day. We signed 2 in the Birmingham office on that day. Sadly, yours was an hour behind the first one, so but it was still on the same day. And thanks to Kirsty, who gave up some time of her holiday to give us the right signatures to enable us to get that opinion signed on the 31st of October. So it is a really good news story. As you know, the value for money work that this report is all around focuses on the arrangements that are in place for 24-25. So you'll be familiar with the financial sustainability, the governance, and what we call the 3 E's. It's probably worth noting that there are different types of recommendations I can make as a result of the work we do on the value for money. That ranges from statutory recommendations, which we don't make very often but is increasing in the sector currently. You don't have any of those. We then have significant weaknesses. Again, you don't have any of those. We then move to improvement recommendations, which are areas for you to consider. And they're the sort of recommendations that if you don't make progress on them, they can turn into that significant weakness. So we make those improvement recommendations if we think there is action for you to take. Something that is new this year is something that we call an insight. And it's an area that we have noted that you do something on, but we are challenging you to go a little bit further in terms of best practice. So it is a choice for you as a council as to whether you want to take those up, but we have noted those, and you have one of those sat in that report. As everybody has alluded to, this is a good report. Financial sustainability is probably the one I would talk about. You will recall last year I raised an improvement recommendation around the DSG deficit. That remains, but I think what's important to recognise is this is in the context of sector, and there are degrees of deficit, for want of a better phrase, and there are degrees in terms of how individual councils are tackling that deficit and the arrangements that they are putting in place. So again, just to put it in context, nationally across Grant Thornton, I think at the last time we collated, which was pretty recently, I think we'd raised 29 significant weaknesses for those clients that we audit. So almost every upper tier had a significant weakness around the DSG deficit. You are not in that category. You are in the improvement recommendation category. We have also issued statutory recommendations at some councils around the DSG deficit and the arrangements they have in place to deal with that. So while we have raised an improvement recommendation, important to note that within the context of the whole sector. Again, as Kirsty said, we'd noted an improvement recommendation around the 3 E's area, and that's around the performance reporting. And as has been already mentioned, officers have provided responses to all of the recommendations, and they're included within the report. So I was going to stop at that point, but really happy to take any questions. Does anyone?
Kate?
Hi, everybody. Thank you. Thanks, Helen. Well, congratulations on a really good report. I think as the Director of Governance, my brain goes to the AMBERs and the improvement recommendations, so I don't know that I felt quite so optimistic, but then I'm from an NHS background, so I think there are some obvious differences, and you've explained some of the context. I suppose the concern for me today is looking at some areas where the action remains the same, albeit worded as superseded, and with some new actions in here that could turn to more statutory requirements if the improvement's not made, from what I understand. Do you have confidence that the council will complete the actions in a timely way? Because I guess when I look at the culture of follow-up recommendations, it's maybe not where we would want it to be in terms of internal audit actions. So in terms of external audit actions, are you confident, based on your knowledge of the council, that they will be done in a timely way? And also, will we find out how they are progressing and being closed during the year without waiting until next year's year end, noting that obviously the year end position is now December that we're looking at this? Thanks very much. Yeah,
So the the idea of the improvement recommendations and the superseding, I think what it recognises is the direction of travel. So I think with those recommendations, particularly in the action plan that are superseded, it's recognising that arrangements were put in place, improvements were made, but maybe the situation has changed slightly. So if you think about the improvement recommendation we made around DSG last year, we could still see that improvements are being made to the arrangements, but the deficit continues to grow. Part of that is all the things that have previously been described this evening. But from our perspective, it is still important to put it on the radar and to make sure we continue to raise it, which is why we have continued with that improvement recommendation, albeit it looks different from what it was last year, recognising that the council has made steps towards it. So I think I'm absolutely confident from working with the council over the last couple of years that those actions will be taken that need to be taken, and we've certainly seen that through. You think back to the financial statements audit, how much earlier we've been able to close the accounts for 24-25. I'm just checking I've got my right years. Compared to the prior year, it was a huge step forward, and part of the reason for that step forward is the collaborative working, the understanding what didn't work, what do we do differently, and moving it forward. So with that backdrop, I'm confident that answers your question, Kate.
Councillor Ross.
I agree with the comments made earlier by Councillor Johnson. Entirely agree with them. There are two comments I want to make. I'd appreciate clarification on page 46 of the £418,000 of misstatements is the term that's used. £418,000 to the public would be deemed to be a material amount in relation to the size of this council. I'm assuming that that's misallocations over account heads, and it's not something that impacts upon the profit and loss account. And the second point is, I'm not sure, Helen, whether this is actually, I'm asking you, or I'm asking Councillor Johnson, or indeed our monitoring officer. It's a subject close to my heart. It was the government that originally requested as a separate exercise the value for money report. And I believe that this is an issue that's of extreme importance to residents. And the way that it's actually has been recorded historically in our systems requires people to search through for the statutory accounts. Now, as I said, I'm many years, decades, indeed, away from finance, but I would not rush to look for a set of statutory accounts. But I am interested in the value for money that the council is delivering. And this is about messaging. So I repeat my request. We need to do something as a council to bring the importance of this report to the attention of the public. Thank you.
So if I start with the unadjusted misstatements, and then it might be one for you to consider. The unadjusted misstatements are the misstatements that were identified during the financial statement audit. So they were reported as part of our audit findings report that we reported at the last committee. It does, and it was the totality of the unadjusted misstatements that we identified. Without going back to that report, I'm struggling to recall what they were, no. But they were significantly below our level of materiality, which is why they have not been adjusted for.
Individually?
Yes.
Thank you.
Any other questions, members? Okay, I think Councillor Payne.
I might be accused of brown nosing, but I say well done to everybody involved, because it's really heartening. It's and again, with LGR coming, it'll be very nice to be able to go into the various negotiations with a little bit of the moral high ground for once. Thank you.
You've stolen my lines, Councillor Payne. Yeah. I mean, yeah, I think, yeah, credit where credit's due. I mean, this year, you know, I think I was reading in there, there's only about 1 out of 9, you know, councils throughout the country to get this all done on time. So, you know, credit where credit is due. Congratulations and well done, everybody. The bar is set, though, so no pressure for this year, peoples. Okay. So for the annual report, the recommendation is that considers the content of the Auditor's Annual Report 2024-2025, Appendix A, including the unqualified audit opinion and the value for money commentary. 2, endorses the management responses to the improvement recommendations and agrees to monitor progress through the committee. And 3, notes that the Auditor's Annual Report was published on the Council's website in accordance with statutory requirements, having been considered by the committee virtually as agreed at the meeting on the 30th of September 2025. Please, could I have a proposer and a seconder? Proposer, Mr. Councillor Rapine, seconder, Councillor. Sorry, Councillor Chatfield, I did see Chatfield first. All those in favour?
It's unanimous, Chair.
Thank you. Sarah's across the way there. So item 11, the Information Governance Policies Review, to receive report number 121, 2025 from the Head of Legal and Democratic Services, namely Sarah. Thank you, Sarah. The floor's yours.
Good evening, Chair. Thank you very much. This is a report detailing the updating of the 4 information governance policies, which are the Data Incident Response Policy, the Data Protection Policy, the Data Retention Policy, and the Regulation of Investigatory Powers Act, or commonly known as RIPA policy. Previously, the reviews were undertaken by Cabinet, but on the last occasion when they reviewed them in June 2024, they indicated going forwards that they would, for the work to come to Audit and Risk Committee. Audit and Risk Committee already receives a report, the annual report on information governance, so it appeared to make sense for them also to have oversight of the policies. There is a requirement that the RIPA policy is reviewed annually, and as a matter of good housekeeping, we took the opportunity to review all 4 policies. A few years ago, 3 or 4 years now, they were given a significant update in terms of compliance and so on, and even last year there were more updates in terms of language, keeping them simple and so on. This year only a very light touch review has been necessary, to the extent that I didn't put 2 versions of the report in the papers. There wasn't the need for a before and after, very much just some track changes to tighten up wording, make them simpler again. Going forwards, before I undertook the review, I did wonder whether it was, if I'm honest, overkill to review all 4 of them annually when the requirement is only for the RIPA policy to be reviewed that often. But I have to say that it was a useful task to have reviewed all of them and to be going through the discipline of looking at them in detail regularly. And going forwards, I would like to tie in the review of the policies with the annual report on information governance that you receive, because that appears to be more sense, and then as a committee you're seeing the full picture. That would be for next time. So for now, Chair, the amendments are as set out in red in the enclosures. Other than that, unless there are any questions.
Thank you, Sarah. Any questions, members? Kate?
Sorry for all the questions, I'm learning. I won't always ask this one. I wondered if the Audit and Risk Committee ever received assurance over compliance with policies, because I note that only one of the policies had a compliance measure in it. So I didn't know whether that was a standard set of assurances that are provided to the committee over whether staff are actually complying with policies. Thank you.
Not with regards to the review of the policies themselves, but in terms of the annual report on information governance, because that's where we would provide the statistics on our performance throughout the year. So it would be part of that we would look at the degree to which we believe policies were being complied with, and therefore that's why I think it makes sense going forward for the 2 things to come together, because it's the appropriate time to look at it if it is that we feel that the figures are below what they should be.
Thank you. Can I just come back quickly on that? That sounds really sensible. Thank you. Appreciate that. I just wonder if you were going to do that, whether all of the policies would need a compliance measure so you would know what you were measuring so that you could report it in that way, or whether there was a reason why only one of them was felt to have a measure in it.
There isn't a particular reason, but certainly that's incredibly helpful feedback, and I will implement that into the review of them. So thank you. And again, within the report on the overall performance, so that that's identified as part of that. Thank you.
Any further questions from members? Okay, thank you. I mean, I must admit, the RIPA policy I read through, not really aware of that. I've probably got questions, but you probably won't be able to answer them. But a yes or no would probably be useful. Have we ever had to instigate that?
No. No, this isn't an authority that's ever used those covert surveillance powers, but we still have to give a null.
Thank you. There's no further questions. The recommendation is that we approve the minor amendments marked in red on the 4 policies appended to this report. May I propose and a second? Councillor Karen Payne. Second. This is from our point of view. We have to vote. This is on this particular item, this motion put forward. We don't, part of what we do is just note, the officers bring in and we note reports. On this item, we've got to approve it. So the officers are asking us on these 4 items in red to approve. We have to ask. Councillor Payne has provided, unfortunately you don't get a voting right, Kate. So Councillor Payne is proposing, you don't have to worry about this at all. And I've got a seconder from Councillor Hemsley. All in favour?
It's unanimous, Chair. Thank you.
Okay, so no problem at all. Right, on to item, on to item 13, Treasury Management Mid-Year Update. To receive report number 122/2025 from the Strategic Director for Resources, Kirsty stroke Andrew, to present and take questions. Thank you.
Thanks, Chair. So this is the second report this year we've brought to you about Treasury Management. So we brought one at Q1, and this is our mid-year report, so based on the Q2 figures. Treasury Management and compliance continues to be in line with the Treasury Management strategy and the MTFS in terms of our performance against our income targets. And it demonstrates that we are adherent to the Treasury Management Code of Practice by CIFA as well. The key points regarding Treasury Management activity so far this year is that all 11 prudential indicators are on track, as you can see in Appendix A. We've invested 54 million to date as a local authority, split between 47 million with banks and 7 million with other local authorities. They are delivering above the budget in those, largely down to delays in cash flow around the council's capital programme. We've reduced our debt to 14.3 million, which is, during the year we've paid 4.5 million pounds worth of debt. Again, that saved us long term, so it's looking at what investments we can get and how we manage our council's liquid assets to best meet our budget going forward. And in the report it shows that we've identified 3 risks around market risk, liquidity risk and credit risk, and all of those have a low residual risk level. Again, overall the Treasury Management is a positive report from the finance team and shows that we are adhering to the policy set by council.
Thank you, Andrew. Any questions, members? Councillor Karen Payne.
Thank you, Chair. Yeah, another good report. That's great. That's great. I've just got 2 small questions. We repaid £4.5 million of historical debt off, and note that there's 0.9 million savings over the lifetime that loan. Was there any penalty involved that will be offset by those savings?
Yes, there would have been, but we can amortise that over the same period as well. So we are allowed to put any of redemption fees, but what we do is we factor that into our total calculation. So any business case that I put to Kirsty in terms of repaying debt will include those total costs.
Okay, thank you. And the other question was, we've got £7 million invested with other local authorities, and I remember a shaky moment with Thurrock not many years ago. How do we qualify the investment with other local authorities, and what risk do we carry, if anything?
So since the Thurrock incident, we changed our policies and practice in treasury management. So we now look at the financial performance of the local authorities we are looking to invest in, what their reserve levels are they receiving exceptional support from MHCLG. So any publicly available information we can on the financial standing of that local authority are looked at before placing any investments. We make sure that we follow the CIFA Code of Practice, which says security, liquidity, yield. So we will always follow that practice in terms, with the first one being the surety of the investment we make.
Thank you very much.
Councillor Rapine.
Yes, I've been trying to forget Thurrock, but we won't go into that. This might be an unfair question, but they're always the most fun ones to ask. Interest rates. You probably need a crystal ball at the moment to have some idea of how, I get nods, how interest rates are going to go. Have you been given any advice as to how you think they might be going to go in the next 12 months and how that would affect us?
So we take advice from our treasury management advisors, and they produce their own forecast, as well as they give us a benchmarking example as well. So we have two benchmarking to use. We also do our own analysis as to what would be the impact in terms of 25 basis point increase or decrease from that position, and what would that impact be on our financial performance as well. Generally speaking, this financial year the forecasters have been pretty much, with rates have fell in line with where we was expected. It might have been Monetary Policy Committee one after the rate rises, so maybe a 3-month delay, but largely they've been in line. It is trying to predict, use a crystal ball to predict, but we do use as much information out there as we can to help inform those decisions, to maximise it. What we also do is make sure that we have a spread of our investments they spread over the year, so we do short-term, medium-term and long-term investments to try and minimise that impact of those interest rate reductions, because we get locked in for a period of time on interest rates.
Thank you. Councillor Hemsley.
Thank you. I noticed in the report it was a sort of prediction or an assumption that the inflation was at 2%, but if you go and look at it, it's somewhere between 3.6 and 4%, depending on which crystal balls you're staring into or measures. How much of an impact is that going to bring to us in that situation?
Inflation not dropping at the rate we expected when we set our budget last year will cause us an issue with our budget, but it's one of our key risks that we identified, so we are looking into that as part of this budget cycle to ensure we give adequate resource available to support the contract negotiations that we will need to have in terms of those contractual inflations. In terms of investment and the rates we receive, it flows into that interest rate prediction. So obviously if inflation doesn't fall to the levels expected by government, that will have a long-term impact on the stance taken by the Monetary Policy Committee in terms of when they choose to reduce interest rates or use interest rates to help drive some of that inflationary change.
That would appear not to have currently worked, with the Bank of England sort of trying to manage it, but also, if you read the sort of the doomsayers version of the world generally, you're seeing that actually there's a good chance that inflation is going to go quite fast, a long way for us. And when you're doing the negotiations and planning, it's just making sure that we've got it in our sort of mind. I'm sure you have, but it must be a huge concern trying to work out where it's going to go, and especially negotiating contracts and all the things with food waste, all that stuff rushing towards us at great rate. So, good luck.
Come back. we do try to look for opportunities when things like that happen as well. So us repaying our debt has come about because of some of those impacts. So for instance, the latest debt repayment we done was on the back of Donald Trump introducing tariffs and the impact on the market at that point. So what we also do is look for those opportunities that some of those things give us as well. There's not a lot out there, but we do look for those opportunities as well. It's not just trying to look at the negatives and what the negative impacts are, but we do look for opportunities too.
Councillor Ross. I suspect actually before Councillor Henry, I think the next item on the agenda will be addressing part of the question you've asked there. So anyway, Councillor Ross, if you'd like to.
It's a point of clarification, Andrew, and I'm certain I've probably asked it before. If you actually look at market risk and a change in interest rates could impact on borrowing costs, and that's assessed as medium, and the mitigation is not reliant on borrowing, which we all know, and the residual risk is low. Just from my tiny mind, how have you assessed one as medium, which is the overall risk, given where the starting position is? Thank you.
It's because that is the inherent risk we have, that interest rates may increase. So if the council does have a need to borrow, then obviously the inherent risk we've got as a council is quite high because of the volatility we've seen in the markets. If we have to go to the PWLB, we will be able potentially seeing those rates. So then we say, well, actually, we don't have a need to borrow at the minute, and also we're locked in terms of those long. So that's how we do it. It's inherent risk.
Any further questions, members? Okay, so the recommendation is that since prudential indicators directly relate to financial sustainability and risk, it is recommended that the committee review the current performance against the prudential indicators as approved in the Treasury Management Strategy, as contained in the medium-term financial strategy. That's a bit of a mouthful, apologies. This review will detect early signs of financial stress, ensure transparency in capital and treasury strategies, strengthen confidence among those charged with governance that financial decisions are sound, and of course the prudential indicators are shown in Appendix 1. Councillors, we only have to note this report, so thank you very much. On to item 14, review of the reserve strategy, which I think was saying that we may be looking at our points of mitigation here. We will receive the report 124/2025 from the Strategic Director for Resources, Kirsty or Andrew, to present. Thank you.
Thank you, Chair. I mean, even if you listen to some of the presenters today in terms of risks that council are coming, there's a lot of those risks inherent in the organisation. They change particularly really how we manage them. So that's the reason why we're presenting this strategy. It's alongside the review of the MTFS and submitting that. So yeah, it's a key document for managing the risks. The number of risks that we're facing are around rising demand, as again we've heard about consistently tonight, expectations from the public and from central government in terms of what do they expect us to deliver and the funding we get for those. Rising cost of service delivery, we've just had the discussion around interest rates and what that might mean for some of the council services, and obviously the level of funding we get to provide those services, is that keeping in pace with the increase in costs? And obviously what we heard about earlier as well is those DSG deficits as well. So the report sets out how we currently have derived the reserve strategy using the CITFA Code of Practice to help us manage that, and also the robustness statement from the Section 151 officer, Kirsty's requirement to manage the overall position of the council and make sure that we are financially stable. And obviously the policy must not only ensure that we manage for the short term, but over the medium term of the financial strategy as well.
Thanks, Andrew. Questions from members? From my perspective, I just would comment as well. I think the point with the ESG has been, we've all asked that question. We've had government guidance, which looks 2027, 2028, but looking at your, you know, your risk management scenario, we're going to be 10 million short in 2 or 3 years' time. Either way, I can't see Magic Fairy coming out and paying that for us. And obviously with interest rates as they are, possibly councillors such as myself that are saying have a spend thing and leave a legacy thing, I think that may have to be reviewed. So thank you. No further questions. Did I see Kate late there with? Okay. Okay. So it is recommended that the committee reviews and notes the current reserve strategy as set out within the integrated budget plan and the medium-term financial strategy, and that committee is asked to review that the adopted approach continues to provide sufficient financial resilience and remains an appropriate basis for the refreshed strategy to be incorporated into the 26-27 and future financial plan. Thank you. Right, we move on to item 15, where I got asked for the exclusion of the public. I need to, well, is that okay? Because I need to move it from the chair, apparently. I will formally move the chair for the meeting to go into closed sessions for the reasons set out in the agenda. Can I propose her? No, I've proposed it. Councillor Hobbit, Councillor Evans seconded it. Thank you very much. All those in favour?
Unanimous, Chair.
Thank you. And Mrs Johnson left the room. So
Well,
to
I'll
the
keep it very
work
brief,
plan.
Chair. It's in the papers. The only reason why there's only March at the minute is the diary calendar for meetings for programme meetings of 26, 27 are currently being sorted at the moment. So once those dates are originally booked in, I'll add them to the work plan, and obviously officers can then add their items they wish at that point.
Everybody happy with that, members? Yeah. Okay. Item 19. Any other business? I have not been notified of any other urgent business. So item 20, date of next meeting will be Tuesday the 24th of March at 7 p.m. in 2026. So before I close the meeting, it just leaves me to say thank you, officers, for support. It's been a good meeting tonight. Thank you for your candidness, and thank you, members. And we'll probably see each other before Christmas. For those I don't, I would like to extend greetings for the time of year, and we'll see you all on Audit and Risk in the new year. And with that, I will close the meeting at 9:32. Thank you very much.
Thank you.